Good afternoon, ladies and gentlemen. We'll give a minute or so as people join, and then we'll start shortly. Right, I believe we have reached critical mass, and we will commence the webinar. We've got an hour for this, and I think it's very exciting discussions. Again, good afternoon, and welcome to the SAHPRA webinar focusing on SAHPRA attaining global recognition as a stable and well-functioning integrated regulator and attaining WHO maturity level 3. My name is Sibusiso Hlajago. I work for PATH as a Director for External Affairs for the Africa region. And also PATH is a member of the South African Health Technologies Advocacy Coalition, a group of non-profit organizations which advocate for health in South Africa and in the region. First of all, congratulations to SAHPRA for attaining this milestone. It's a massive milestone for the country. And the reason and rationale for today's discussion is for SAHPRA to unpack what this means, the maturity level 3, what it means for South Africa, what it means for vaccines, and also where it places our national regulator in the continent in terms of advancements and development, and also in terms of recognition by WHO, and also in terms of working with entities in South Africa to access global markets, particularly for vaccines. We'll also look into what it means for the country going forward after this is, after attaining the level, the ML3 from WHO, what does it mean in terms of opportunities that come with this ranking? And also, we hope that it will help in terms of improving understanding in terms of vaccine production industry in South Africa as well. So we've got an exciting panel that's going to take us through what this means. And at the end of the session, we will address questions. There is a Q&A, table or function on the webinar itself. So if anyone has got questions, please post them on that Q&A, and they will be directed to any of the 3 panelists that we have at the end. And then also, if for those that will be in promoting this webinar, you will receive a hashtag still on the Q&A function that you can use in terms of promoting this function. Joining us for today's discussion, we've got Dr. Boitumelo, and she's the SAHPRA CEO, and she'll give an overview of the ML3 and the impact on mRNA Technology Transfer Hub. We also have Portia Kambule. She's SAHPRA's Chief Regulatory Officer, and then she'll speak to regulatory processes and alignment to WHO. And then we've got Christina Reinecke. She's SAHPRA's COO, and she will speak to SAHPRA's maturity journey from maturity level 1 to 3 and what will happen going forward as well. With that being said, welcome everyone to this webinar. And I'll hand it over to our SAHPRA CEO, Dr. Boitumelo. Over to you.
Thank you so much, Sibusiso, and good afternoon, everyone. Thank you for joining us in this webinar, where we're quite excited really about what SAHPRA has been able to achieve in terms of the maturity level status. And before I say more, I'd like to thank the entire SAHPRA team for all the hard work. It certainly was not an easy journey, as you will hear from Christina when she presents. And it demonstrates really teamwork, not only within SAHPRA, but across the country. You will note when Portia and Christina present that there are some functions that are evaluated wherein the assessors don't only look at what SAHPRA does, but they look at this function at a country level. And this speaks to, for example, oversight of clinical trials. It also speaks to pharmacovigilance. And we'll go into a bit of detail around that. But what I would like to focus on really is the big picture of what this means. As you all are aware, the WHO set up initiatives for establishing mRNA technology hubs. And this was with the intention to increase mRNA vaccine production, particularly to increase the capacity in the underserved regions, in low middle income countries, with the intention to promote regional health security. And while the initial focus was on the mRNA technology, I am aware that there are conversations taking place around other vaccine technology platforms, as there is quite a range. In addition to the efforts of the WHO, many institutions in the country are looking into establishing capability for utilizing other technologies of vaccine production. And the strategy that the WHO focused on was in response to the COVID-19 pandemic, wherein we saw vaccine supply challenges. And this really plagued us as the African continent. A number of you will remember that at the beginning of the rollout, a number of countries on the continent did not have access to these vaccines. We saw the wealthy countries prioritizing themselves. We saw those governments procuring quite early on before some of these vaccines were even manufactured because they could pay the highest price. And so this effort is to ensure that Africa does have that security in supply of health products. For me, this signals an important move by the continent to say Africa needs to be at a point where it can manufacture its own health products. We were also under pressure at some point when India limited or even banned any export of vaccines. And these were vaccines that were manufactured out of the Serum Institute of India, which would be made available to countries on the African continent. And so as stakeholders on the continent, we have to do our part to say, how do we enable Africa to be at a point where it can manufacture its own health products? The aim of the WHO mRNA hubs is to support then the manufacturing of vaccines, specifically using the mRNA technology in low and middle income countries, to enable them to produce their own vaccines, ensuring that they have all the necessary know-how, they have all the necessary operating procedures to produce these vaccines at scale, and not only for their respective countries, but also to support the region. And the intention is that this manufacturing would be conducted according to global best practices of good manufacturing practices. So we are aware that in June 2021, the WHO announced that it had selected South Africa, the South African consortium specifically composed of Afrigen Biologics, the South African Medical Research Council, and BioVac as the South African vaccine producer. The hub would not only support South Africa, but they would support a number of other countries. So the intention is that the vaccine that is manufactured out of this hub would need to be exported to other countries. This hub has already been established. They've already set up the lab and have already started producing at a lab scale. And scaling up as well as validating these and commercializing these are some of the activities that are planned for the very near future. However, in addition to the South African hub, the WHO also announced Egypt, Kenya, Nigeria, Senegal, and Tunisia as part of these hub and spoke model. So these countries will also be manufacturing mRNA vaccines. And with all of this said, there's an important role that regulators in the respective countries play. I'll speak first about SAHPRA to say one of the reasons why a number of these countries were nominated or even given the status of these mRNA hubs was the understanding that the regulators in these respective countries would be able to support the manufacture of safe, efficacious, as well as quality vaccines. And therefore, we needed to ensure as SAHPRA that we do our part in ensuring that the mRNA hub is supported, but also that our own systems would give confidence to the global regulatory community as well as the WHO. As a national regulator, while yes, we do have some skill sets to conduct full assessments of dossiers for new vaccines, and we've demonstrated that we are able to do this during the COVID pandemic. We've demonstrated that we can play a very strong regulatory oversight for clinical trials conducted on the continent. And also we demonstrated that we can conduct vaccine lot release at a level and a function where others could rely on our assessments. But while that is the case, there is also an appreciation that as a regulator, we are undercapacitated. And so there are a number of efforts that we are working on to ensure that we increase capacity and we increase our capability to be able to support the manufacturing that will be taking place in this hub. But also our view is not only limited to South Africa. We operate on the continent, and as SAHPRA, we have a very strong Pan-African view in what we do. We have been part of the discussions under the Pan-African Vaccine Manufacturing Initiative, wherein we have offered to assist other NRAs, particularly those that do not have control release labs, those that do not have the capacity that we have in terms of assessing dossiers, particularly conducting full assessments. And while we have offered that, we have also indicated the needs that we have. And therefore, you will see us participate in a number of initiatives on the continent to support other regulators as well as other countries, fully understanding that we should not compromise our own capability. And it's with all of these thoughts that we work so hard to ensure that SAHPRA does receive a maturity level status 3, because it speaks to the quality of our work. What it says is that we are a well-functioning regulator that has integrated systems that others can even rely on the work that we do. What this means also for industry is that any product that is manufactured not only through the mRNA hub, but any vaccine that is manufactured in the continent that goes through a rigorous clinical assessment in the continent, having the oversight of SAHPRA, that goes through a rigorous assessment of the dossier by SAHPRA, and lastly, a rigorous assessment when it's been authorized for release into other markets. It says that the world can then trust that these vaccines are safe, effective, and are quality. And therefore, for industry that is looking to manufacture locally, having a regulator at this status bodes well for yourselves, not only in the local market, but also internationally, because you are then able to have your product compete with that is manufactured in other countries. This for us is quite important because we understand that a number of companies in South Africa, particularly these that will be manufacturing vaccines, are not only going to manufacture for the South African market, they will be manufacturing for Africa and for the rest of the world. And thus, making sure that your regulator applies the required stringency to ensure that your product is a trusted product. While we do so, for these hubs that have been identified, we will continuously wear the gatekeeper hat as a regulator, because that's our core function. But also there is an understanding globally, and even on the continent, that there are instances wherein we will have to walk the path with those that are manufacturing, particularly new entrants into vaccine manufacturing, wherein we support you in the process. And our support will be very clearly articulated, and our support will be transparent. But we will, at a point, ensure that we wear our hat as a regulator to ensure that the products that you manufacture, they stand the scrutiny of any regulatory assessment. And so as I wrap up, and I'll be handing over back to Spusiso, and my colleagues will go into a lot more detail, I want to thank the SAHPRA team, as I've indicated, for all the hard work. We could not have achieved this without the work that the team put in place. We would not achieve this without the support that we get from our external expert assessors. These are the individuals that ensure that we're able to evaluate even some of these new technologies. SAHPRA will be investing into upskilling our own internal staff to be able to assess some of these very complex technologies, and also will ensure that we are able to recruit very senior staff who will be able to enable us to deepen and increase our capacity. And so we're quite excited about being able to reach this ML3 status for vaccine. And specifically, we reached ML4 for the lot release function, which for us is great because this is the highest level you can get for any of the functions that the WHO assesses. And therefore, it says even for those countries that do not have release labs, like countries that are neighboring countries like Botswana, Namibia, etc., they can then rely on the decisions that SAHPRA has made through the control release lab. And so I really just want to commend all our stakeholders, including our respective labs that we work with, in ensuring that we're able to reach this level. Thank you, Spusiso. I'll hand back to you.
Thank you so much, Dr. Semeta. Thank you for the overview and also just highlighting what this means for South Africa, what it means for vaccine manufacturing, what it means for the private sector that's manufacturing vaccines. But also thank you for highlighting what SAHPRA is doing to support vaccine manufacturing and also to support other countries in terms of ensuring that the vaccines that will be manufactured are safe, but also in terms of building their capacity. We'll proceed and we'll have Portia who will speak to regulatory processes and alignment to the World Health Organization. Over to you, Portia.
Thank you, Spusiso. Yes, good afternoon, everyone, and thank you very much for attending our webinar. I'll go straight into the presentation, into what WHO was looking at when they were doing the assessment. This is how the WHO global benchmarking tool looks like. It has about five sections. The first one being the systems or functions that they will look at. This include, the regulatory functions that the regulator, does, and it also has indicators that will talk to what those particular functions should be looking into, and also the sub-indicators, and lastly, the fact sheet. And also there is a questionnaire for, for other products or activities that will be required to be completed. And with regards to the system function, what they did was that they were looking at 9 functions, and then 8 of them are regarded as common functions, which are expected to be, performed by all the regulatory authorities. And then there's the 9th one, which is called non-common function, which is the lot release function, which other countries might not be able to do, as they might not be, either manufacturing vaccines or even the process of doing that. Going back to those, the regulatory functions. Yes, I've listed those 9 regulatory functions. And for each of the regulatory functions, what they will do is that they will look at, or assess the legal provisions, the regulations, the guidelines that, enables that particular functions. They will also look at the organization and governance. They will also look at policy and strategic planning, and also the leadership and crisis management of that particular function, and transparency, accountability, and communication, including the quality and risk management system. That includes also the quality management system, and also the regulatory process itself, and including the resources that are required to perform that regulatory function that talks to, the infrastructure, the equipment, experts required, and so forth, including IT system. And they will also look at, the monitoring, of progress, and also assessing the impact with regards to that particular function. So when we look at what SAHPRA does, we are responsible for evaluating, inspecting, registering, monitoring, and investigating all health products. So with regards to evaluation, we evaluate any application that comes to the regulator, be it for clinical trial, the conduct of clinical trials, for registration, for import and export, and so forth. And we also inspect the sites, and following that, we also register medicines, and we also monitor those medicines whilst they are on the market. And this will be enabled by the Medicines and Related Substance Act of 1965, as amended several times. And we also have general regulations, including the guidelines. So now trying to, to link the 9 functions that the WHO assessed SAHPRA on, with regards to regulatory system, SAHPRA has an administration program that review or look at and support the core business with regards to finance, with regards to procurement, with regards to the governance and compliance. That is the also issues that has to do with human resource and IT, and including information and communication. And when it comes to core business functions, those regulatory functions that I spoke to in the initial slides, the clinical trials regulation, what we regulate is all the applications for clinical trials for phase 1, 2, and 3. We don't regulate preclinical studies. And for any of these phases to be conducted, SAHPRA, they need to be approved by SAHPRA, and also there has to be ethics approval. And CEO earlier on spoke about the collaboration with other regulators and also with other stakeholders. In this particular case for clinical trials, what they were looking at was that not only what SAHPRA does to get to the stage of approval of a clinical trial, they also looked at how is SAHPRA collaborating with the ethics committees when they're doing the clinical trials reviews, because you might find that in some cases that there would be a trial that has got ethical issues that the ethics committee has issues with, and there is that communication between the ethics committees and SAHPRA with regards to approval of a clinical trial. And also, the National Health Research Ethics Council. This is the body that accredits, the ethics committees. They also provide the oversight role with regards to how the ethics committees does their work and so forth, including their funding. And this is all this is what WHO was also looking at. So it wasn't because they were assessing SAHPRA, then it means that it will be just the SAHPRA part only that gets assessed. So it is what they're looking at is at the national level to say how are clinical trials regulated in the country. And they also looked at the databases that we had and how we shared those with other bodies and so forth. The other function that we do as the regulator is the medicines or vaccine registration. And from the WHO process, they call it market authorization. So in this particular slide, they were looking at the process, how we, accept applications and how do we do the reviews, and also whether is there a process that we follow in case there's a public health emergency, and also how do we prioritize our applications, or whether do we have a policy in place that talks to prioritization of medicines, and also in the case of public health emergency as well. And they will also look at whether the regulator does apply reliance, especially with the applications that have already been approved or registered by other regulatory authorities that SAHPRA aligns itself with. And So in this particular case, they looked at also the processes that were followed when reliance is being applied. With regards to the inspectorate functions, they looked at the different types of inspections that we're conducting as the regulator. We're conducting good manufacturing practice inspections, good wholesaling practice inspections, good clinical practice inspections. These are for clinical trial sites, and good pharmacovigilance practice to ensure that the holder of certificate of registration do comply with the pharmacovigilance activities as indicated. And with regards to the licensing of establishment, this is another activity that we do, a function that we do as a regulator. Here we license manufacturers, we license wholesalers, distributors for import and export of medicines. And this happens after inspection of a site, and once a positive resolution has been received from inspection that a site can now be licensed to be able to manufacture or even to wholesale products and so forth. And products that we're referring to, it could be medicines, it could be scheduled substances, medical devices or IVDs. But in this particular case, we were not audited or assessed with regards to medical devices and IVDs. WHO is still working on a tool that will deal with this particular products. And as we do this activity, we're also looking at the requirements, the acceptable quality assurance principles, and also the good manufacturing and distribution practices as the authorities may determine for us to be able to issue the license. With regards to the function of pharmacovigilance, we know that the information about safety and efficacy for a product is only available from clinical trials before registration, before a product is registered. And once that is registered, SAHPRA does monitor the safety of health products to contribute to better understanding of this possible adverse events. So we receive adverse drug reactions that are reported by consumers, that are reported by healthcare professionals, and so forth, the public, and this does provide information for SAHPRA safety monitoring program. And once those are received through Med Safety app or any other means, they are causality assessed by our NISEC, that is the National Immunization Safety Expert Committee, to establish causality. And we also do collaborate with the National Department of Health Pharmacovigilance Unit, the EPI unit, that is the extended program on immunization, and also provinces, districts, and facilities. So that is also what WHO looked at. They did not also just look at SAHPRA in isolation. SAHPRA's activities is in isolation. They went deeper into checking the national pharmacovigilance framework of the country and what happens with regards to reporting reports as they're being received and so forth, and the collaboration between SAHPRA and the National Department of Health Pharmacovigilance Unit, and also the EPI unit. And the other function that we also do, the post-marketing surveillance, we do have officials at ports of entries as per our regulations. There are specified ports of entries that are indicated in the regulations. We do have staff members present at these ports of entries, and we do have working relationships with SARS and Port Health, and who report on medicines entering, other border posts. And with regards to medicines that there might be some issue with them, the applicant can also issue what we call recalls. And in some cases, it could be SAHPRA initiating the recalls for those medicines that needs to be brought back and destroyed. And we are also part of a rapid alert network where we collaborate with all other regulatory authorities globally. And this is where this information about, substandard medicines that could be circulating in any other country or could have been manufactured elsewhere is shared in this platform. And it alerts all the regulators, simultaneously to see if there's any problem, and also to to trigger the regulators to start, acting with regards to what would have been reported. And what we also do as part of post-marketing surveillance, we do sample medicines that are already on the market, registered or not registered, and then test them. This is based on risk. And we also do laboratory testing. This is for quality control lab. We do have a lab that does this function, and they do quality control testing of medicines. And we use those lab testing related, reports to make decisions as the regulator. And the last one being the lot release. This is the National Control Laboratory that we have in Bloemfontein. This conduct and enforce lot release for all vaccines. So for any vaccine, before it can be used in the country, it has to be tested and be released by this particular lab. And I think this is my last slide, and thank you.
Thank you so much. Thank you so much, Portia, for taking us through the regulatory processes, the alignment to WHO. You've highlighted the great work that SAHPRA does to enable a conducive environment for both clinical trials, manufacturing, whilst also ensuring that the products are safe and reliable. You've also mentioned the collaborations that SAHPRA has with entities, different entities in country and out of the country. And next we will have Christelna, who will speak to the journey that SAHPRA has taken to reach to maturity level 3, and also what's going to be next going forward as SAHPRA works towards maturity level 4. Over to you, Christelna. Christelna, are you on mute? Might want to unmute, sorry.
There we go. Sorry, I'm just figuring out where to put it on slide mode. There we go. Thanks very much for the opportunity just to take you guys through also our journey with regards to the WHO global benchmarking process. I do just want to get the slides moving along. So basically what we have with the WHO global benchmarking process is we have a tool now that was developed by the WHO, a unified tool from 2014 that has obviously been going through refinement since 1997 when the WHO actually started this process, and that based on a resolution that was taken at the World Health Assembly, specifically focusing on a process where the World Health Organization can use a tool as a means of assessing regulatory systems for the compliance to a unified standard or norm, and also then through that process to assist regulators to focus on strengthening the regulatory systems. So the tool itself is used then basically to identify strengths in the regulatory authority or in the regulatory system, and also identify certain areas for improvement. It helps then to formulate a specific institutional development plan, an IDP as we refer to it, dealing with, as Portia's referred to, the specific sub-indicators in each of those functions, where we can continue to build on the identified strengths, or then also use those IDPs to guide us in closing any gaps before we are marked in as complying with that specific indicator requirement. It further then aids you to prioritize those IDPs and the specific interventions that's required for you to close gaps or strengthen specific areas, and then help you to monitor your progress and your achievements as you basically then close these off and move through to the next priority. So with the process of the WHO Global Benchmarking Tool, we in fact started our journey in 2019. So this was just prior to the pandemic. We first started our engagements with the World Health Organization, putting up our hands saying that we were also interested in being assessed against this tool. And the intention, of course, then for us at that stage was to assert ourselves as a maturity level 3 as a starting point, And as you can see, there are basically 4 scales which regulatory authorities are assessed against. Your maturity level 1, which indicates basically then that you've got some elements of a regulatory system that is existing. Your maturity level 2, that indicates that it's an evolving regulatory system, and it partially performs some of the regulatory functions. And there again, we refer to those 8 common functions, and then the 9th common function, which is then relating to lot release. Maturity level 3, which was the aim for SAHPRA as a regulator, was to be then a stable, well-functioning and integrated regulatory system. As we then move to our maturity level 4, which is our aspiration, being then recognized as a regulator with a regulatory system operating at an advanced level of performance and continuous improvement. Very important to note also that the concept of maturity level, in fact, was adapted from the ISO 9004 standard, and this then being used so that the overall maturity of a regulator can be assessed against these 4 scales. Our specific roadmap or journey, I think it takes us through, as we said, we started effectively in 2019 with the first engagements. And then, of course, we were plagued by the pandemic, so with no pun intended, for the subsequent period, and really only got traction on this again in late 2020, October 2020, when our quality management systems manager joined the organization. And we then very actively started with the QMS awareness training that was conducted with all of our employees. In 2021, we have our quality policy that was established with the quality objectives. And that, of course, as we said, feeds very much into the overall WHO GBT system, in that a lot of the principles applied in ISO find their way or has found their way into the WHO GBT tool as well. In then March, April 2021, we were able to complete process mapping exercise and also complete our training on the WHO GBT tool. For then the remaining of 2021, the focus was very much on the content development in our standard operating procedures, enhancing some of the content in our guidelines and policy documents. And further to that, then, of course, the implementation of some of the IDPs that were identified during our own self-benchmarking process, which, as we indicated, we conducted in 2019, helping us to prepare then for our initial assessment, which took place in November of 2021. We were visited by some of the WHO colleagues and went through that initial assessment process, and then continued to work with them with their guidance on completing the identified IDPs and closing some of the gaps that we had remaining. And we were then very happy to receive them for our final assessment in September 2022, where the final assessment was then completed and we were able to attain the maturity level 3. And as Dr. Boitumelo had indicated, for lot release specifically actually being rated at a maturity level 4, which is very encouraging, I think, for the local vaccine manufacturing industry. Focus for the remainder of 2022 as well as 2023 really will be on working on the items that has been marked as ongoing implementation. And these very much center around also, again, quality management system implementation. So quite some work going into that, as well as Portia has indicated, work that is being done with other stakeholders, National Department of Health, as an example, working on the pharmacovigilance indicators, as we then progress to an assessment for maturity level 4. So 2023 really will be very much still plodding away at completing the IDPs and the sub-indicators that's required for the maturity level 4, as they've been set out in our fact sheets. I think just also, I suppose, recapping on what Portia's discussed. So the GPT tool allows then for that overarching evaluation of your regulatory framework and those 9 functions that we were assessed against for maturity level 3 is what they will also look at when they visit us for the assessment on maturity level 4. I think one thing that we do want to note, obviously, as this is a continuous journey for us, and it will continue to be something where you have to make sure that you stay on top of your continuous improvement aspects, is also to look at moving towards the WHO GBT plus for medical devices and IVDs, as we then further entrench the regulatory oversight around this specific health product category. It is in fact also SAHPRA's intention to become a WLA, which is a WHO listed authority, that basically replacing the concept of SRA or stringent regulatory authority. And this, of course, through this process of progressing to maturity level 4. This will, I think, as the colleagues have pointed out, strengthen our ability to collaborate with other benchmark national regulatory authorities, and of course also to use the concept of reliance for health product reviews and registrations in partnership then with other global regulatory authorities. And certainly being a WLA or at a maturity level 4, certainly I think will aid also our industry colleagues to ensure that their products are fast-tracked through perhaps a reliance process review with other NRAs. And certainly also, as we indicated, gives that reassurance to the rest of African countries that it has been overseen by a regulatory authority that applies the right standards of safety, efficacy, and quality. Thank you.
Thank you so much for that presentation, Christella. I think whilst you still well, it's just finished. I think there are a few questions I think that I'll pose to you from the chat. The first one is on what GBT stands for. I think you've mentioned it several times. And then there are also a few questions from Melissa, which speaks to how long did it take for the approval or for SAHPRA to reach maturity level 3, and also was the application fast-tracked? And as I think the last part of it is will all countries of the spokes of the MNRA hub need to have regulators with maturity level 3? I don't know, Dr. Witumel, if you want to respond to that, if we, either yourself or Christella. You are on mute.
Thank you very much. Thanks for those questions. I'll also start with the one from Puvi in terms of, does this enable emergency use listing? So the emergency use needs to be catered for in our Medicines Act. And what we've done is that while it's not then reflected yet in the Medicines Act, we've got a framework to enable emergency use listing borrowing from Section 21. So one of the projects that we're busy with is a complete overhaul of the Medicines Act. And so this will then be included as a prescript there, but they were happy with the framework that we had for emergency use authorization. I'll then address the questions in terms of when did we apply. I think Christina spoke to that. So the official initial assessment was in November of last year, as Christina indicated, and then they came back then for the final assessment for the vaccine function now in September, and they will then return for the medicine function evaluation. Was this expedited? No, not at all, actually. I mean, as Portia and Christina indicated, we did our self-assessment in 2019, and because of COVID, they couldn't come in 2020 and early 2021 for the initial assessment. So actually COVID had a negative impact from a timing perspective. And so we managed to then address that when things opened up. I wouldn't say it was expedited, but certainly having South Africa host the mRNA hub did put some pressure on it to be prioritized, because WHO is assessing quite a number of other countries. And then in terms of, do all the spokes need to have regulators at ML3? Not necessarily. I mean, you'll note that other countries that are part of the spoke, their NRAs have not been assessed yet, and there's no outcome at this point. And so, which was also the case with us, right? So you may find that some of them, the assessments have started and they are in progress. So it would really be at different stages. I mean, the expectation, though, is that wherein then the country is not at ML3, that we will apply this twinning mechanism that I spoke about to then support those countries to reach ML3 quite soon. Thanks, Spusiso. I'll pause here.
Thank you so much, Dr. Tumi. Maybe before we move on to the next set of questions, it's just to stress that we've got a hashtag for the webinar. It's hashtag SAHPRA webinar on ML3. For those that have got any that might want to go social media, that's the hashtag that we are using for this webinar. I'll also encourage people to continue putting questions onto the Q&A chat, and I see that we have a few other questions, and I think, Dr. Boitumelo, I'll come back to you as well for the next one, which is SAHPRA, the SAHPRA level 3. Does it relates only to vaccines, and then what impact does it have, and also does SAHPRA intend to obtain ML3 for medicines and other products as well?
I think I'll ask Portia maybe to speak to that. I'm happy to do, but I think just to spread.
Yeah. Portia, you can come in.
Sorry, Chair. I was just quickly looking at the other questions on the charts. Which one do you want me to respond to?
The one from Tammy, do you see that? I'm happy to take it if it's going to take you a while.
So there is one from...
Okay, the one from Tammy about SAHPRA WHO level 3 relates to vaccines only. Please advise any impact on allopathic medicines, or does SAHPRA intend to obtain WHO level 3 for medicines? Some authorities have ML3 for vaccines and medicines, e.g. Ghana, Singapore, and Tanzania. With regards to the medicine part, we still, the assessment is still continuing, because what they do is, as I've indicated, with regards to all those 9 regulatory functions, they still now are busy with the assessment of the PV system in medicines. So once that is done, then we would have completed the assessment for medicines part. And yeah, I don't know if CEO you want to add?
Yeah, and also just to correct that in Africa, so it's only SAHPRA and Egypt that's at ML3 for vaccines. Ghana, Nigeria, and Tanzania are at ML3 for medicines. So none of us at this point have got ML3 for both functions. And Singapore, they're currently at ML4. Correct me, Push, I think it's for medicines only, not for vaccines, or either one of the two. So they'll always look at them separately. And we're hoping then to be the first to have ML3 for both vaccines and medicines, but no one in the continent has for both at this point.
All right. Thank you, Dr. Boitumelo. I think just to also spread, there's a question from Ceci for Christina. Christina mentioned that other countries may use SAHPRA as reliance review. Is SAHPRA using reliance pathway to review vaccines, specifically WHO pre-qualification? I don't know if you want to respond to that.
Sibusiso, I actually have to defer to Portia on this from a technical perspective, but I think what I have indicated is as all of the regulatory authorities, start to elevate their maturity levels, reaching their maturity levels 3 and 4, it enables regulators to actually rely on work between the regulators so that we can use the reliance pathways. And specifically for products that are WHO pre-qualified, there is an element where the technical teams do look at the WHO pre-qualification during their assessment, and where there are elements where we can place reliance on some of the work that has been done either by the WHO pre-qualification unit or other regulatory authorities that we align with. We are then in fact able to use that review information and review reports, whether it be for vaccines or other medicines. I don't know if Portia maybe just wants to add anything to that.
Chris, I think you've covered it all. And just to mention that we have indeed used the reliance pathway when we're reviewing the vaccines. We had reports from WHO PQ team. We also had reports from other regulatory authorities that we align ourselves with. Thank you.
Right, thank you, Christina, and thank you, Portia. There is a related question that says, does SAHPRA have WHO collaborative registration process in place? I don't know if you need to add anything to that, because it still speaks to reliance and fast track for WHO pre-qualified products.
Yes, Busiso, I can take that. Yes, we do have the collaborative procedure in place. We are a member of WHO PQ process, and we also are a member of the Zazibona collaborative review process. And we do receive applications that would have received that had reports from WHO, and that we use for reliance, as we do that review. And what we do is that it's not like we fast track these applications, but we follow the timelines as indicated in the collaborative review process by WHO. Thank you.
All right, thank you for that. And then I think the next question that I'll pose is from Ari, and starts by congratulations, SAHPRA. And then the question relates to SAHPRA's inclusion in the AMA, that's the African Medicines Agency. How does the ML3 and soon ML4 status impact South Africa's GWP, GMP guidelines and alignments with AMA, if at all? And would other countries then be able to use the reliance pathways from SAHPRA via AMA? I don't know if anyone wants to take this one, or should I repeat the question?
No, I think we're looking at it. Portia, do you want to take that? But maybe before Portia comes in with that one from Ari, I want to just, there was a question earlier when I wanted to reflect on in terms of how we're funded and whether that has had an impact. And to say that, we continue to receive funding from National Treasury. I think some of you have heard us making a call and ask for increased support from the National Treasury, particularly to capacitate the organization. We are undercapacitated, but also to support some of our digitization initiatives. And so that's a call that we continuously make. So at the moment, we are engaging with National Treasury, and we will see what comes out of those discussions. When the WHO assesses us, they do look at at elements of sustainability. From a perspective of human resources, they look at, do you have adequate human resource for what you need to do? So they have raised this, as an area that we need to improve, that we must increase the capacity within SAHPRA. So while we do understand that there's fiscus constraints, we have gone out to try raise funding from various funders to assist us with certain projects, and even specifically around capacitation. And these we do report on in our annual report. You will see in the latest one of the last financial year, we indicated what support we got from external funders, and we will continue to do so as we receive that support. It then also says, you know, a number of you have seen that we have increased the fees, and it's because we have to ensure that we bring in the required capacity and capability, but also digitize the operations of SAHPRA. Thank you. I'll hand over to Portia.
Thank you, CEO. With regards to that question, whether, you know, let me quickly go to that question. Yeah, whether, SAHPRA's inclusion with the AMA, and how does ML3, soon ML4 status impact as SAGWP and GMP guidelines and alignment with the AMA? If at all, will other countries be able to use the reliance pathways from SAHPRA via the AMA? For this one, I would like to respond as follows, that there is what we call AMRH. This is African Medicines Regulatory Harmonization Initiative that is run by NEPAD. And in this MRH, there are technical working groups that have been, you know, established with regards to different regulatory functions. And one of the technical working group is the regulatory inspections. And this one, South Africa chairs. And what would happen is that for each of these regulatory functions, they will be expected to work on developing guidelines and so forth for the region. And I wouldn't say that all the other regulatory authorities will be using SAHPRA's you know, guidelines, but what will happen is that there will be those guidelines that will be developed by these technical working groups of AMRH, and that these technical working groups, you know, will be reporting into AMA. So in a way, this will be a collaborative work that will be done by all the other regulatory authorities and so forth. So what I can also say is that, as I've indicated, that South Africa does chair the working group on inspections. Thank you. I don't know if CEO, you want to add?
You've covered it well. Thanks, Portia.
Right. We still have a few questions on the chart, and looking at the time, I see that we might not be able to have all the questions addressed. There's been a request for this meeting being recorded. It is being recorded, and the recording will be made available. I think from my end, before I hand over to the SAHPRA CEO, it's just to thank SAHPRA for availing yourselves to provide information on progress that's being made and share light in terms of plans for next, what is next from here in terms of the maturity level as well. And also just to avail yourself to respond to questions that people in the sector have as well. And I think it does read well, and it helps a lot in creating or strengthening the confidence that the country has. And again, from myself, Pat, and everyone, congratulations for this milestone, and over to you, our CEO, for your closing remarks.
Thank you, Sbusiso. And just firstly, thanks to Pat for being our partner as we host these webinars and platforms to engage the public on many, many matters. And thanks to you for your support, really, we appreciate it. And just to conclude, and I'm sorry that we couldn't get to all the questions, but please do engage with us. I see there's some questions around clinical trials, about inspections, etc. You know, do send through those. We'll try to respond to these. We'll capture these questions. I just want to thank all of you for joining, and I hope that, you know, as you represent various stakeholders, that you realize the benefit of having a well-functioning regulator. I know at times we don't always agree on our regulatory requirements, particularly with industry, but it's because we have to meet, you know, these global standards. And as per our mission, you know, we want to be agile, we want to be responsive, be clearly an African regulator, but also ensure that globally we are applying best practices, because it not only supports SAHPRA, but it supports the broader stakeholders in South Africa. The second part that I'd like to mention is that this, again, as the country and the continent is working towards vaccine manufacturing and production, I think it is ever so important that we have a regulator that is regarded as among the best in the world. And lastly, one of the elements I'd like to raise is that, you know, during COVID, I mean, we experienced a lot of pressure from various stakeholders, and we stood our ground really to say we will make evidence-based decisions. And it is being firm in that regard and demonstrating that stringency that has enabled us as a country really to be at a point where we can celebrate our regulator. And so while we must indeed have robust discussions, we must at times, you know, lock heads, but it is important that we note that the regulator will always make decisions that are based on very strong and very good scientific evidence. And I'd like to thank all the stakeholders that are represented here today in supporting SAHPRA to reach the status. And thanks to Portia and Kristalna for being co-panelists on this webinar. Thank you so much, everyone.